Welcome to Week 4, Unit 3, NSC 303. Today's discussion topic is Health for All. And in this topic, learners' goals for this Unit 3 are: define health for all, discuss the meaning of health for all, describe global strategy for attaining health for all, explain the national strategy adopted to achieve the goal of health for all, list the targets and achievements in health for all, and lastly, discuss the role of nursing services in support of health for all. In Unit 1, we have discussed the concept and prerequisite of health. And in Unit 2, we discussed about primary health care, its concepts, principles, elements, and role of nurses in promoting the primary health care. You have seen that primary health care is the essential care which should easily available, acceptable, accessible, and affordable to an individual and community as a whole. You have also become aware, based on what we have covered in Unit 1 and Unit 2, of Alma Ata Declaration, which affirms that primary health care is considered as the basic strategy for achieving goal of health for all by the year 2000 AD. In this unit, Unit 3, we shall discuss the concept, definition, and meaning of health for all. Achievement of goal of health for all aims at restructuring of health system and reorientation and training at different categories of health workers or professionals. Fulfillment of these aims is only possible through development of an appropriate strategy. We shall discuss further the global and national strategies for health for all and focus on achievements and targets of health for all and the nursing support of health for all at international and national level. Concept of health for all. As you know, there is a vast contrast in the health status of people in developed and developing countries, despite of much scientific and technological advances in healthcare. You are also aware that most people in developed countries and elites of the developing countries, including Nigeria, enjoy good health, enjoy nutrition, enjoy sanitation, good sanitation, safe drinking water, education, income, and so on and so forth. In Nigeria, 80% of the population lives in rural area and urban slums, in contrast to 10 to 20% who lived in urban areas. It is only this small fraction. It is only this small fraction. It is only this small fraction of urban people who enjoy ready access to health services and facilities, and fraction of urban people who enjoy access to health services and facilities, whereas the rest of the 80 to 85% living in rural and urban slums areas do not have access to health services or health facilities. Similarly, if we look at health status of Nigeria as reflected by the number of indicators of health, there is need for urgent improvement on our health status. The disparity in health and socio-economic conditions between rich and poor within countries and between countries, and the concern of members of WHO, that is World Health Organization, regarding status of health and deterioration of existing health status leads to new thinking in provision of health care in regards in order to narrow this gap and finally eliminate it. It was also realized that the underprivileged population constituting 80 to 85% of the total population have an equal claim to their rights and privileges of health services, such as health care, protection from vaccine-prevented communicable diseases of childhood, e.g., diphtheria, tetanus, TB, whooping cough, polio, etc. Maternal and child health care and treatment and control of non-communicable disease. So, there was first a need among health planners or health administrators for involving a healthcare approach that will answer the problems and needs of underprivileged. Ultimately, the 30th World Health Assembly resolved in May 1977 that the main social target of governments and WHO in the coming decades should be the attainment of health for all by year 2000 AD. We covered this in Unit 2. That was last week. Furthermore, there are several other experiences and developments which led to the evolution of goal of health for all by the year 2000 AD, which are as follows. In 1972 to 1973, the WHO study on the development of health services concluded that there was a widespread dissatisfaction among people with their healthcare systems, which were failing to cope with primary healthcare problems in countries that are all stages of development. In the rural areas and rapidly expanding urban areas, millions of people still remain without access to essential health care and life-saving measures. All these concepts led to a continuing discussion of how healthcare system should evolve and how WHO could best support countries struggling to improve their health system, expressing the ideas that were dominating the international discussion during 1960s and early 1970s. The World Health Assembly decided in a groundbreaking resolution in 1977 that main social target of government and WHO in the coming decades should be the attainment of all citizens of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. With the adoption of these resolutions, the Health for All movement was born, and the slogan Health for All was created. With this concept in mind, we shall discuss the definition and the meaning of health for all. Health for all is an holistic concept. It is thus defined as the attainment of a level of health that will enable every individual to lead a socially and economically productive life. It simply means that healthcare services are to be made accessible and within the reach of every individual in a given community. It implies the removal of obstacles to health, that is, elimination of ignorance, malnutrition, disease, contaminated water supply, unhygienic housing, etc. It is an expression of the feeling for social justice from all those who suffer inequality in healthcare services. To have a correct perception of the meaning of health for all, you should be convinced that health is to be brought within the reach of everyone in a given country, including the remote parts of a country and the poorest members of the society. By health is meant not just by this is meant not just the availability of health services, but a personal well-being and a state of health that enables a person to lead a socially and economically productive life. This means that health should be regarded as an objective of economic development and not merely as one of the means of attaining it. And health begins at home, in the school, and in the workplaces. So people can use better approaches for preventing disease and alleviating unavoidable illness and disability, and even distribution among the population of of whatever health resources that are available, that the essential health care will be accessible to all individuals and families in an acceptable and affordable way and with their full involvement. It aims at bringing about the change in the mentality of people, reconstructing of health system, and reorientation and training of health workers. So to bring about these changes, the practical shape to the slogan of Health for All could be given only through development of a strategy. Strategy for Health for All. As you have seen, as we have discussed under Unit 2, Alma Ata Conference called on all governments to formulate national policy, strategies, and plans of action and set down the principles of primary health care, which is the basic of health for all strategy. In 1981, Global Strategy of Health for All was involved by WHO through consultations with countries, regions, and at the global level. That strategy defines the broad lines of action to be undertaken at policy and operational levels, nationally and internationally, both in health sector and in other social and economic sectors. This was followed by individual countries developing their own strategies for achieving health for all and synthesis of national strategies for developing regional strategies. Global strategy. The global strategy for health for all is based on the following fundamental principles. 1. Health is a fundamental human right and a worldwide social goal. The existing gross inequality in the health strategies is of common concern to all countries and must be drastically reduced. Thirdly, people have the rights and the duty to participate individually and collectively in the planning and implementation of their health care. Fourth, governments have a responsibility for the health of their people. Countries must become self-reliant in health matters. Health is an integral part of the overall development of the countries. Energy generated by improved health should be channeled into sustaining development of a country. And lastly, better use must be made of the world's resources to promote health and development. And this will help to promote world peace and prevent conflict among nations. National Strategies for Health for All by 2000 AD. And Mahatta Declaration and Nigeria Commitment to Health for All by 2000 AD resulted in the formulation of national health policy. The federal government of Nigeria convened a national conference in February 1988 to discuss the national strategies and action plan to achieve health for all. In July 1988, a working group on health for all to involve national strategies for implementation of healthcare programs to move toward the goal for health for all by 2000 AD and to suggest suitable indicators to monitor the progress achieved from time to time. The working group submitted its first report in 1989, which was accepted by the federal government. Thus, a national health policy was involved by governments of Nigeria in 1989, which commits the government and the people of Nigeria to achieve the goal of health for all by 2000 AD. This policy lays stress on the preventive, promotive, public health, and rehabilitation aspect of health care and points to the need of establishing comprehensive primary health care services to reach the population in the remote area of the country. The health policy in Nigeria has the following key elements. One, creation of a greater awareness of health problems in the community and means to solve this by the communities. Supply of safe drinking water and basic sanitation using technologies that the people can afford. Reduction of existing imbalance in health services by concentrating more on the rural health infrastructure. Establishment of a dynamic health management information system to support health planning and health program implementation. Provision of legislative support to health protection and promotion. Concentrated actions to combat widespread malnutrition. Research into alternative methods of healthcare delivery and low-cost health technologies, and greater coordination of different systems of medicine. Lastly, the health strategies include restructuring the health infrastructure, developing health manpower, and research development. Important indicators to achieve health for all. The following are the indicators to achieve health for all. One, reduction of infant mortality rate from the present level of 87 to below 60 by 2000 AD. To raise the life expectancy at birth from present level of 58 years to 64 by 2000 AD. To reduce the crude deaths rate from the present level of 10.4 to 9 by 2000 AD. To reduce the crude birth rate from present level of 27 to 21 by 2000 AD. To achieve a net production rate of 1 by 2000. To provide potable water to the entire rural population by 2000. You must have been aware that during the 6th and 7th 5 years plans, steps were already undertaken to implement the strategies outlined in National Health Policy. Some of these are: 1. To establish one health sub-center for every 5,000 rural population, that is 3,000 in tribal and hilly areas, with one male and female health worker. 2. To establish one primary health center for every 30,000 rural populations, that is 20,000 in hilly and tribal areas. To establish community health centers. 4th, to train village health guides selected by the community for every village or 1,000 rural populations. To train traditional birth attendants in each village. Lastly, training of various categories of health personnel, e.g., multipurpose workers. These schemes are expected to ensure the availability of adequate infrastructure and medical and paramedical manpower to take us nearer the goal of universal provision of primary health care as envisaged in the National Health Policy. Nursing in support of health for all. In 1979, WHO and International Council of Nurses (ICN) conducted a workshop in Nairobi on the role of nursing in primary health care for leaders of nurses associations, in which the commitment of the nursing profession to the goal of attaining health for all by 2000 was formally confirmed. Subsequently, National Nurses Association planned their own strategies in relation to their own national health policy. The National Association of Nigerian Nurses and Midwives also participated in this exercise. Then in 1981, an informal meeting was convened in Geneva by WHO on November to consider the role of nursing in contributing to the achievement of the goal of health for all through primary health care. Strategies and actions were then proposed for change at international and national level. On this figure 3.1, which is captioned 5 strategies for change adopted by National Nurses Association for their role in health for all through primary health care. 1 is development of corps of well-informed nurses. 2 is nursing at policy and decision-making level. Nursing practice in primary health care. 4, fundamental changes at all levels of nursing education. And lastly, research in nursing, administration, practices, and education. We shall now unpack each of these strategies. Don't forget that the first one is development in each country, the development in each country of a corps of nurses that is well informed about health care and ready to bring necessary changes in the nursing system. The inclusion of nursing personnel at all levels of policy making and administration so that the profession can contribute to determining the action plan. 3rd, the involvement of nurses and the use of their skills in initiating or extending primary health care. Fundamental changes at all levels of nursing education, from basic, post-basic, and continuing, to ensure that the priority needs of population are functionally integrated into the education and into nursing practice. Research into nursing administration practice and education that will demonstrate nurses' contribution to PHC. Actions proposed at national level strategies. 1. Development of corps of well-informed nurses has these 2 requirements. 1. Arranging and developing a series of international, national, and regional workshops or other meetings that could bring together small groups of key nursing practicing professionals for orientation and guidance in planning for primary health care in their own country. And 2, develop texts, guides, communication aids, which will include review of current publications related to PAC and production of specific material to nursing in PAC. Arranging and developing a series of international, national, and regional workshops or other meetings. Now we are unpacking these points now. One, the purpose of these workshops would be to help the nurses to understand the trust of PAC nationally and internationally. Two, to interpret needs of these countries in their struggle for health for all and enable them to develop overall nursing plans of action at local, regional, and national level, taking into account local needs and resources. To establish the regional support system and lines of communication between and among countries for sharing plans, exchanging methodologies, and report on the progress as the plan is further developed and put into effect. Secondly, we have nursing at policy and decision-making levels. We are unpacking this. This will require planning and implementing training programs and continuing educational programs that will reorient nurses and train them in administration and management techniques, political and legislative processes, and help them to analyze existing legislation and enable nurses to develop action programs to bring about necessary changes. Creation of administrative posts in nursing at all levels of government. This can accomplish through coordinated effort of National Nursing Association. Establish a system for collection and compilation of information on the supply and training of nurses as per the needs of the community. Third, nursing practice and primary health care. This calls for preparing and educating the nurses to assume responsibility for the provision of first-level care in the community. This can be achieved by conducting workshops, seminars, and other continuing or in-service education programs, encouraging the nurses to practice primary health care, providing facilities like housing, attractive remuneration, and opportunity for continued learning to the public health nurses working at the PAC, making efforts to close the existing gap between nursing education and nursing service. Fundamental changes at all levels of nursing education. This will require the administrative support from the national and local governments in order to change the system of nursing education. This change involves reorientation in basic nursing education, post-basic nursing education, and organizing continuing education programs. Basic nursing education. This includes change of curriculum for current system of nursing education and practice, and formulating strategies for bringing about a change in basic nursing education from emphasis on care of sick individuals in hospital to community-based nursing education. post-basic nursing education. This will involve preparation of nurses for leadership roles in administration, for supervisory posts in organizations and agencies at all levels of healthcare planning and management, and for teaching posts in primary healthcare. Preparation of nursing researchers who can conduct or direct investigations into primary healthcare issues, as well as encourage systemic inquiry into questions related to community-based nursing practice. Continuing education. This involves organizing workshops, seminars, and in-service programs to enable nurses to acquire additional knowledge and skills related to primary health care. Research in nursing administration, practice, and education for primary health care. This needs inclusion of research skills in all the nursing education programs and continuing education programs. Nurses at all levels should develop an inquiring and problem-solving attitude for working towards the goal of PAC. Priority should be given to research into the design and evaluation of programs in which nurses provide primary health care and study of problems that arise from the nursing in primary health care field. Government and intersectoral support should be sought for proposals that will enable nurses to initiate or collaborate with others in research methods and design for primary health care. Develop projects to demonstrate usefulness of research findings in nursing practice. This is the conclusion of Unit 3.